Basically, what I decided to do was put out an open invitation to doctors from every country in the world. And my invitation is that I'm willing to come to your country, meet with you and your staff in your office or hospital and patients, and show you how this perceptual technique works and how effective it is in the day in, day out of clinical health care. Of course, I thought that my own country would be the first country to step up to the plate, so I'm pretty excited that Ecuador has been the first country to invite me to come and speak to physicians. I'm here in Guayaquil, and I've been in Ecuador for about the last 5 days. I've spent the last 3 days translating my keynote from English into Spanish, and my presentation is tonight at 7 o'clock, so in just a few hours. Because of the accuracy of the technique, I saw instantly the value of sharing this information with not only healthcare providers, but from people all over the world, because we all have a human body, so you might want to know that you have this code of health that your body speaks.
Yo le pedí el favor de que nos diera esta conferencia, esta introducción, y ojalá podamos aprender algún día su técnica y ayudar a nuestros pacientes. Muchas gracias. Le agradezco también a Manuel que nos va a servir para traducir.
¿Vamos a comenzar?
Comenzamos.
Gracias por todo. I want to say as we get started that what I do does not have anything to do with chakras, and it does not have anything to do with auras.
Y para comenzar quiere aclarar que lo que él hace no tiene nada que ver ni con chakras ni con un aura.
That there's nothing unique or special about my perception compared to yours.
Y que no hay nada especial acerca de la percepción que él tiene comparado con la de cualquiera de nosotros.
I see the same that you see when you look at a human being.
Él ve exactamente lo mismo que vemos nosotros cuando miramos a cualquier persona.
I have just learned what to look for.
Solo que aprendió que tenía que buscar.
While I have studied at many universities in the United States,
cuando estudiaba algunas universidades en los Estados Unidos,
I have no medical training whatsoever.
No tiene ningún tipo de entrenamiento médico.
And I am not scientifically trained.
No tiene un entrenamiento científico tampoco.
But I am able to think scientifically or critically when it is important.
Pero tiene facilidad para pensar en una manera científica cuando es importante.
For people that have a musculoskeletal,
un problema del sistema muscular esquelético.
This to me is a very obvious indicator.
Este es muy obvio.
Easy to perceive.
Muy fácil de darse cuenta.
And I would describe it as that people's faces are shiny, waxy.
Son como grasosas, brillantes, las caras, los cutis, la piel.
How many of you notice people that when you look in their face, like if you look at me, you would not say my face is shiny or waxy, would you? No. It is not. But you know when
The very purpose of the Impact Project was realized during this presentation in Guayaquil. Rather than me identifying indicators with people in the audience, one of the doctors in the room identified a woman in the audience with a musculoskeletal indicator and confirms that the ability to apply cognitive techniques is accessible and can be learned.
For example, Veronica.
Yeah, she has a bit of the waxing. You want to stand up so everyone can see? Maybe if you come up and stand next to me, and then you can compare. Okay. Do you notice the difference? Okay. Like first degree, right?
Yeah.
So just a little bit of musculoskeletal stuff going on? Okay, yeah.
In this particular situation, this woman had some complications with her hip.
A problem with the hip.
Ah, okay. Gracias. Gracias.